Hi, I'm Dr. Wix-Harris, and I'm a cosmetic physician at Reflection Center in Martinsville, New Jersey. And today I'm going to talk about sun damage and what kind of effect sun damage has on the different skin types. So sun damage can show as brown spots, and they usually start off flat, as flat sunspots. Over time, some of them become raised and turn into what we call seborrheic keratosis. Another sign of sun damage is fine lines and wrinkles. It's caused by loss of collagen in the skin, which makes the skin thinner and makes it more easy to wrinkle. And then finally, in some people, sun damage also shows itself as redness. It causes the capillaries to dilate, and you can get, either redness on the cheek or the chin. Some people will have redness on the chest and the neck. That's called poikiloderma. And those are all signs of sun damage. So in cosmetic medicine, we use the Fitzpatrick Scale to differentiate between the different skin types. And it runs from skin type 1 to 6. And it really is determined by how your skin reacts in the sun, because that will tell us how your skin will react to the laser. For example, skin type 1, which are people who cannot tan at all. They will only burn in the sun. They're usually of West European descent, like Germany or England. And they have blonde hair, blue eyes, and you can actually treat them with a laser at very high settings because they will not react to the laser as intensely as people who have, for example, skin type 6. Skin type 3 and 4, which are people with light olive to medium olive skin, that's actually sometimes a little bit more difficult to determine in which category they fall. And it's important to know because the people with skin type 4 can have complications if you treat them as a skin type 3. We have to be the most careful with people who have skin type 5 and 6, and usually those are easy to determine based on the skin tone, but also on their history. They have very dark skin and they never burn or very rarely burn in the sun, but you have to be very careful when you use the laser on darker skin type because you can actually create issues. So it's important to know and determines people's skin type when you're treating sun damage, because it's really important to decide what is the best and safest laser to use to treat, for example, fine lines and wrinkles or sunspots or melasma. Because of this, it's important if you have a variety of lasers available to treat the different skin types and the different types of sun damage. So another important thing to consider when deciding what kind of treatment to choose for somebody that has sun damage is to consider what kind of downtime they can have. Some people have to go to work and they can't have a lot of downtime. They don't want people to know. So use a very gentle laser for that gives you minimal downtime, like Clear and Brilliant. But because it's so gentle, the effect is going to be pretty subtle. So you're going to have to do more of those in order to get good improvement of sun damage. Now, if you have very mild sun damage, that's a great laser to use. If you can afford a little bit more downtime, like maybe 4 or 5 days of redness and peeling, then you can do something a little bit more intense, like a Fraxel Restore laser. And if you don't care about the downtime, but you just want everything done in one session, then you go with something more aggressive, like, for example, a CO2 laser. Another thing that's important to consider when you're trying to decide what's the best treatment for people is the amount of discomfort that they can have. Some people hate pain and they want absolutely no discomfort, and they just can't make it through a treatment if it's very uncomfortable. So you pick a laser that is gentle, again, like the Clear and Brilliant, versus something that's much stronger and much more intense, like a CO2 laser. Depending on what treatment to choose depends on what part of the sun damage bothers the patients the most or what is the most noticeable. Like, for example, if people are more bothered by their brown spots, you can use lasers that treat pigment. And you can either use a laser that treats just the individual brown spots if there's not too many of those. If there's a lot of brown spots, you want to do more of like a overall resurfacing laser, and that can be either a gentle one, a medium strength one, or a stronger one like a CO2 laser. If people have the seborrheic keratosis, which are the raised brown spots, you have to kind of flatten those first. And usually I like to use Skin Classic for that, but you can also use a CO2 laser for that. And then finally, for the redness or the poikiloderma, we usually use a V-beam laser that targets specifically the red pigment. So another thing that's important for patients is cost. You know, some lasers are more expensive than other lasers are. So we also keep that in mind when we discuss with patients the different options. Finally, it's important to know what area you're treating. You know, treating the face is very different than treating body parts. You know, the face has way more capability to regenerate. So you can treat it much more intense than you can do, for example, the neck or the hands or legs or something like that. Overall, my philosophy in treating sun damage is pretty much the same as it is for all cosmetic procedures. You know, prevention and maintaining is much easier to do than trying to reverse and repair. So I would advise people to use as much sun protection as possible. You can either do that with protective clothing like hats or special UV shirts. Sunscreen is very important, not going out during the hottest time of the day. You know, these are all ways that people can help prevent sun damage. And the less sun damage you have, the easier it is to treat and fix it. So if you have any of these issues, you know, brown spots or raised brown spots or dilated blood vessels, please come see us at Reflection Center in Martinsville, New Jersey.